The cries of a sick child pierce the air of a cholera treatment center. All around, young girls and boys lay unconscious or sit listlessly in the sweltering heat. Parents give their kids special drinks to prevent dehydration. Without such treatment, death can come in just a few hours. This parent says a few days ago his daughter came home from school sick with vomiting and diarrhea.
I was very, very afraid. I ran here with her on my shoulders and they gave her some serum.
The girl has recovered and she'll likely go home soon. But thousands of people are flooding centers like this one, operated by Doctors Without Borders all across the country, says a United Nations spokesperson.
With the rain of the last week, we have seen a surge in cholera outbreaks, very severe cholera outbreaks across the entire country. All the data we have tends to say that we have reached the second peak of the cholera outbreak.
Spread by poor or non-existent sanitation in rural villages and urban slums, cholera has infected up to 400,000 people and killed more than 5,000 of them since it appeared in the country last year. Doctors thought they had it under control, but now the rainy season is back, and so is cholera.
Every time it rains in Port-au-Prince, these streets become torrents of water. They're full of garbage and filth, and it's a perfect breeding ground for disease.
This man says he and his neighbors take their drinking water from this broken pipe. It's free, but it may not be clean. The Haitian government, UN agencies, and non-governmental organizations all badly underestimated the spread of the epidemic, say specialists studying the outbreak.
Our best predictions so far show that over the next year or so, that toll could rise to about 800,000 cases and 11,000 deaths. This is in a population of 10 million people. So you're talking about almost 1 in 10 people being directly affected by cholera.
That initial underestimate means not enough resources were budgeted for cholera treatment and prevention. At the Cotillion Coulant Elementary School, pupils scream with laughter as health workers act out a skit about avoiding cholera through good hygiene. A man who fails to wash after using the toilet shares some food with a friend. And soon, the friend has a big problem. To eradicate cholera will require Haiti to build a proper sanitation system and to provide clean water people can afford. Those things may or may not happen. In the meantime, these children will hopefully remember the lesson to wash their hands, a lesson that may save their lives. Rob Reynolds, Al Jazeera, Port-au-Prince.